On the beats.
You have done great things for me. The Lord has done great things for me. You took my shame, you took my sickness, you took my pain, you took my sins away, you took my sorrows, you took my fear, my affliction, burdens away. This is my story, this is my song. I praise you, my Savior, all that you know. This is my story, this is my song. I praise you, my Savior, all that you know. This is my story, this is my song. I praise you, my Savior, all that you know. This is my story, this is my song. I'm praising my Savior, all that He knows. This is my story, this is my song. I'm praising my Savior, all that He knows. You've given me a new song, a new testimony. You're taking me to a greater height. To glory, this is my story, this is my song. From glory to glory, this is my story, this is my song. Hallelujah, from the mawo, nasinyumia, afatawo. I'm doing my work, this is my story, this is my song. I'm praising my Savior, all that He knows. This is my story, this is my song. I'm praising my Savior, all that He knows. This is my story, this is my song. I'm praising my Savior, all that He knows. This is my story, this is my song. I'm praising my Savior, all that He knows.
Good evening, lovely people. It's such a pleasure to come your way once again. I'm so grateful to God for a successful Igniting Dreams, business vision for young girls and also for our women out there. And I just want to say a very big thank you to each and everyone out there that supported this event. I am so grateful for your support and everything. Each one of you that share the flyers, posted videos, and anything and everything that you did to support this event, I say thank you. Thank you. Tonight we are back to business, and as usual, I just want to raise awareness on things that we hardly talk about in our communities. And tonight we are talking about liver health. Liver health. Now we have a lot of young people just die needlessly because of either their livers actually get failed, or something else actually just happened to them, and many more. So we don't want to use the youth, lose our youth. Sorry, and also we don't also want our elderly also not being aware or do anything also just to improve their liver health. So tonight I have with me one of the best doctors on the soil. Who has achieved a lot. He's won so many awards in his area of expertise, and we are so privileged to have him on the Inside View. Tonight I have with me Professor Rotimi A.K. and Jaiyesimi. Doc, welcome to the Inside View.
Good evening, Nana. Thank you for the kind invitation to do with you this evening. And also thank you to the audience who have tuned in to listen to our conversation.
Thank you. Before, Doc, we continue, I just want to urge each and everyone out there, please, those of us, or like those of you watching, us live, please share this link because this is an important topic. Anytime, it gets to educational programs, we don't get much people, to tune in, but this is so important. Please, this is really taking lives, especially in our communities. So please share this link and let us educate ourselves. And it's so difficult to get, the likes of Professor Rotimi to dedicate, this time to help, all of us out. So please, I'm begging each and everyone out there, please share this link, share, and let us empower ourselves. Thank you. Doc, for the sake of our new audience and also for, people back home who have never heard of you or heard or read anything about Professor Rotimi, could you please tell us something small about yourself? I know you've achieved a lot, and if we are to go into it, it would take a lot of time. So, something brief.
Yeah, I'll try and make it as brief as possible. Primarily, a doctor, a medical doctor who has specialized in obstetrics and gynecology. And over the years, I have shown interest in public health issues within obstetrics and gynecology and outside of obstetrics and gynecology. Uh, Today, we're talking about liver health. Until recently, I was the chairman of the board of the Hepatitis Zero Commission for Nigeria, a commission set up to eliminate hepatitis in Nigeria by 2030. And I'm also a global health expert. And I'm not a hepatologist, I'm not a specialist in liver problems, but I do have the knowledge to be able to educate the public about the potential problems it can cause. So I'll leave it as that. And yes, thank you.
Oh, thank you so much. Tonight we are talking about liver health, and doctor, until I read about how people are dying needlessly about liver, I never knew what the liver actually does. The importance of it, and so many things about liver. So I just want to ask, what does the liver do? What does the liver do in our bodies?
Yeah, first and foremost, the liver is a large organ which is below the right side of the ribs, extending across the middle of the tummy towards the left aspect of the lower aspect of the rib as well. So it's a fairly large organ, and it has multiple functions. For example, for metabolism, it metabolizes the drugs, the food we eat. When we eat carbohydrates, protein, or fat, it converts it into energy that we use. The liver also stores the food we eat as glycogen, so that when we need energy, then we break down what we call glycogen, which is like a glucose kind of thing. And there are some drugs and alcohol that we take. All of these go through the liver, and it acts as, if you want to use a layman's language, an organ that detoxifies these agents so that they do not damage the body as well. Again, the vitamins are produced by the liver, vitamin K, vitamin A, and storage as well takes place in there, as well as iron. So essentially, it's an organ that stores um, energy for us. It also detoxifies things that are harmful to the body and is excreted out. And then the bile acid that comes from the gallbladder also helps with dealing with the fat. The liver also has a role to play in the regulation of cholesterol. You'll hear people talk about high cholesterol level. The liver has an essential role in ensuring that our cholesterol levels are not too high. So essentially, it's a vital organ within the human body.
Wonderful. Um, um, what symptoms, will one notice if their liver isn't working, properly?
Well, that's a very interesting question because most of the symptoms are non-specific. Uh, by the time you get specific symptoms, you probably get into the latter or late stages of liver disease. But in the initial stages, people could have bloating, some form of abdominal pain. Some people will complain of dark or pale stool, joint pain, and you could get any of these in other conditions. That's why I said they are non-specific. And for some liver infections, hepatitis, some don't even have symptoms at all, such that the individual doesn't even know that they have hepatitis A or B or C. They are carriers and they don't know they've got it. So, just to summarize, some people will complain of weight loss, but weight loss can be due to anything. Tiredness, again, fatigue, can be due to other conditions. By the time one is getting jaundiced, that is yellowness of the eyes, then it means that some degree of damage has occurred or is occurring. So it's non-specific, but we have to be aware of our bodies. And usually, what I advise people to do is this: if you notice anything different from normal, any deviation from normality, see your doctor, and then they will run a battery of tests. They will listen to you, take a history from you. I could include what medications are you taking, how much alcohol are you drinking, and things like that. And then they will institute the appropriate laboratory investigations, which will include a liver function test. And that might be what will point us in the right direction.
Great. So, if I'm getting you right, people can still get their livers tested, um, even if they are healthy.
Oh, yes. Well, if you are healthy, you have no symptoms, no headaches, nothing, no body aches, there's no need to just go and do a random test unless you're worried about something, unless you undertake high risk activities. And when I say high risk activities, this will include things like injecting yourself with drugs, drug abuse, intravenous drug users, gay men having sex with men. These are high risk situations. And people like that may want to go to their doctor and say, I know I do this. I would like to have my blood tested. And again, some of the infections of the liver are due to poor sanitation, where the water we drink is bad, there's excreta, fecal material in it. And if you feel unwell in situations like that, most likely your doctor will run a liver function test as part of the other tests they do, just to make sure there's nothing the matter with the liver.
Okay, so how does being overweight or obese affects one liver? So
Well, being overweight is not a good thing to start with. It affects so many organs. It causes so many problems. But specifically talking about the liver, if you are overweight, it just means you are having excessive fat in your body. And then you can have what you call a fatty liver. You're storing too much fat in the liver. So there is fat. If you have a scan and ultrasound examination, you'll find out that there's fat in areas around the liver cells. And if not well managed, then it can go on to liver cirrhosis, which is scarring or fibrosis of the liver, and which can progress over the years to liver cancer. And eventually, if not managed properly, death can arise from liver failure. So being overweight is not a good thing on not a number of areas or platforms.
so then, how does liver disease affect one physically? I mean, how does it affect one physically, after the diagnosis?
Apart from the symptoms I have alluded to, the tiredness, the weight loss, feeling unwell, if one has hepatitis, and there are different types of hepatitis. You've got hepatitis A, you've got hepatitis B, you've got hepatitis C, you've got hepatitis D, as well as hepatitis E. How it affects individuals depends on what stage of the disease it is. By the time one is getting cirrhosis or yellowness of the eyes, that is jaundice, then you have more severe symptoms, and that's when people present to the doctors. Uh, Apart from that, if you do not do anything, then it progresses from just an inflammation of the liver itself to scarring, or you could call it fibrosis or cirrhosis of the liver, which is not a good thing because the liver cells are supposed to be healthy tissues. But when they become scarred or fibrotic, then they can no longer function or perform the function they're supposed to do, like storage of glycogen, like breaking down toxins, dealing with toxins. Then that is where gradually from cirrhosis it can progress to liver failure. And from liver failure, if there's no intervention, then death does unfortunately to occur.
Well, you made mention of, I'll say hepatitis C. And, there's a notion out there that, people of color with hepatitis C fear being, stigmatized. So how can we speak out in order to bring empowerment and also to bring support, in our communities?
I think the yeah, hepatitis C is serious, but I think more of the hepatitis B. But I will still talk about hepatitis C because one does get hepatitis C from using needles, sharing needles, like I said, intravenous drug abuse, sharing shaving razor blades. And this can result if somebody has got hepatitis C and then you use the same needle or you use the same shaving set as that person, then yes, you can get hepatitis C because it's a blood to blood transfusion. That's, I mean, transmission. It's different from hepatitis A, which is due to contaminated stool getting into the food. So increasingly, more so in the low to medium income countries, hepatitis C is a problem. Uh, Not as much as hepatitis B, because you have more people with hepatitis B than you have with C. but hepatitis B and hepatitis C can cause serious illness in individuals. And like I said, ultimately people can die from it. And that is why it's important that if you feel unwell, then you see a doctor, you get screened, and you get treated if required.
So, okay, having made mention of all these, symptoms, do we have any other illness that presents itself, similar to the symptoms of liver, disease? Do we have any, so that people do not get confused, like with the slightest symptoms that they think it mimics, the symptoms of, liver disease?
Uh, what I would advise the public is this. When you have any symptoms, first and foremost, you do not know what it is due to. You feel tired. I mean, that tiredness, especially in women, could be due to the fact that every month they lose a lot of blood during the periods and they become anemic. If somebody is losing weight, excessive weight loss, it could be due to maybe cancer in the body. And so I don't want the public to go away thinking that any odd symptom equates to hepatitis. And what advice I would say is when I say if there's any deviation from normal, you've been well, and all of a sudden you start developing bloating in your tummy, you're feeling tired, you're losing weight, maybe you've got joint pains, then you must see a doctor. And then the doctor sees you, they take a full history, a medical history, and that narrows down to perhaps it could be this, it could be that, and then they do the blood test, and if possible, they do ultrasound examination as well. And it's when you put all those packages together, the history, the examination, the laboratory investigations, including ultrasound examination, can you now narrow down what the condition is to whatever the results suggest. So if it's hepatitis, then you will have that from your results.
Great. So, Doc, what is the best diet to follow, for a healthy, liver? In other words, what are the best ways to keep our liver healthy? Is there
I think a balanced diet will keep our liver healthy. A balanced diet. Excessive weight gain is not a good thing because you store that as fat and you're carrying a lot of fat. And like I alluded to earlier on, fatty liver disease is not a good thing when you have a lot of fat around your liver cells. So that's number one. Then people who drink excessively, alcohol is not good. It damages the liver. So excessive alcohol intake again, which is a public health issue, is not good. It can cause inflammation of the liver. And again, it might surprise uh, all the public that some drugs that we do take, more so when we take them for a long time, over a long period, taking naproxen, brufen over a long period can damage the liver. Even paracetamol, ideally, you should not take more than 8 tablets. Even eight is excessive. You would normally take 2 tablets of paracetamol 3 times a day. So the advice is do not take more than 8 tablets of paracetamol in a 24-hour period. If you do, it can cause acute, that is, it can damage the liver acutely. And when I say acutely, it's not something that's going to present in a month's time. It can be instantaneous. And like we said, we do know that people uh, can die easily from taking paracetamol. And if you go to highly regulated pharmacies, they will not sell paracetamol. The maximum number of paracetamol you'll get is 32. And if you buy paracetamol, they will not sell Brufen to you because Brufen as well can also damage the liver. Uh, so these are the issues: drugs, alcohol, uh, men having sex with men. If they have the HIV virus, it doesn't help. It makes them more vulnerable to having hepatitis B. So those are the issues, and some antibiotics, which I don't want to go into, not to scare the public, uh, can also cause liver damage.
Wow, that's a very, very serious, issue. Um, but it looks like we don't take it seriously at all. Like you made mention of the three stages or stages of liver damage. There's inflammation, fibrosis, cirrhosis, and also the failure part. That's the final. Is there anything that one can do to stop the disease from getting worse?
Yeah, there are. I think one of the things I didn't mention, more so with hepatitis B, one of the commonest ways of transmitting hepatitis B is from a mother who has got hepatitis B getting pregnant and transmitting it to the child. If the mother doesn't know her status, and let's assume it's B, then that baby is going to get hepatitis B. And that is why we advocate public education. That is why we advocate screening for hepatitis, any of the hepatitis, more so B and C. And if you do have it, there's treatment available there are vaccines that one can give to the mother. And when the baby is born as well, they are seen by the baby doctors and they also can be vaccinated. And in doing so, or in doing that, then you can reduce the amount of hepatitis in society. And I know in Africa, in Asia, sanitation is poor. There are not enough toilet facilities, so people use the bush, and water from the bush flows into the stream, and people drink water from there. So you can imagine if somebody has got hepatitis A and they do what we just described, using the bush and water to defecate, then you can transmit hepatitis A in that way. And that's why, again, good sanitation, washing your hands, ensuring that the water you drink is clean, and ensuring that your food is well prepared. In doing that, you're likely to be able to reduce the risk of getting hepatitis A.
Okay, I think I've got a question here for you from Jemima Jampo. She's asked, can any of the hepatitis be reversed?
Can it be reversed? No, it cannot be reversed. When I say it cannot be reversed, there are some that are self-limiting. Yes, you do get it, and the body, especially the liver cells, can regenerate. The liver is one of the organs in the body that regenerates quickly for as long as you do not continue the insult that you have subjected it to. So even though initially I said no, but yes, it can be self-limiting. Even hepatitis B can be self-limiting. And you have a lot of people who are carriers, chronic carriers. They've got it, but they're in good health. It's a long-standing disease, chronic hepatitis. The only sad thing is that it can progress to cirrhosis and ultimately to, like I said, liver failure and if not managed properly, it can result in death. So, yes, it can be self limiting. I wouldn't say reversed, it can be self limiting.
Ijmam, I hope your question has been answered. Your sister's question. Thank you. Um, Doctor, just also, just want to ask, what's one's prognosis if they are diagnosed with some type of, liver disease?
Oh, even of liver, it depends on what type it is and at what stage.
Mm.
Um, if it's early onset, uh, uh, acute liver disease, viral liver disease, and if early intervention is put in place in the form of vaccination, again, if it's due to alcohol misuse and you reduce the amount of alcohol drastically that you take, if it's due to maybe paracetamol or non-steroidal anti-inflammatory drugs, brufen, mefenamic acid, again, statins. It's a little bit controversial. The drugs called statins that we try and use to reduce our cholesterol level, there is some evidence that it could damage the liver as well. But it's a risk benefit analysis that one has got to undertake. So that's what I'll say for now.
Wow.
Do not, if I were going to put it in a sentence, is do not insult the liver or any of the organs in the body. Once we do that, then it's going to damage the organ, it's going to damage the liver. So, like I said, alcohol is not good for it. Uh, Hepatitis, HIV infection, people with HIV, people living with HIV infection are at risk of getting hepatitis B, more so if they are having men having sex with men. Again, that can occur. And if mothers have hepatitis B and they don't know they can transmit it to their children. And the World Health Organization is very concerned about this to the extent that what they have tried to do is to say that by the year 2030, that the aim to eliminate hepatitis globally. Whether that is achievable is a different story, but I know that gradually, as we move towards there, we will at least eliminate quite a number of patients suffering from hepatitis, yeah,
I,
globally.
hmm. I don't think there's much education on this, hepatitis, like either A, B, or C. And I don't think there's so much awareness, unless maybe you happen to get, hepatitis C. That's when you have all these things actually thrown at you. But like overall, there isn't much education um, on all the hepatitis that you're talking about, to us. And I mean, how can we make people aware so that they
Yeah,
can um, informed and also be supported.
yeah. You will notice that earlier on I had said education is important.
Yeah,
Awareness of what can damage the liver is important, and this is through educating the public, either through faith-based organizations, talking like your program today. We're talking about liver health. How do you keep your liver healthy? And like we've said, avoid things that can cause damage to the liver cells. I do not want to reiterate it because we've
sure.
mentioned it already.
Yeah,
Sharing needles, using the same razor blade, injecting yourself with drugs, taking too much excessive alcohol intake, things that can damage the liver. There is a condition called autoimmune disease of the liver. That's not very common. That's when the body just decides to fight its own body. And there's nothing one can really do about that. other than manage it conservatively and hopefully using steroids, it can suppress the autoimmune reaction. But public education is very important. It may, I don't want to sound alarmist, but about 250 million people live with hepatitis B globally, and
Wow.
about 350 million people globally have hepatitis B and C. And that is a vast number of people. And so when we're talking about education, it's more you talk to them about what hepatitis is. It's an inflammation of the liver. You talk to them about how do you get it. We've spoken about the risk factors.
Yeah.
Then the question is, how can I prevent myself from getting hepatitis B? And that can be achieved through screening. You could go for screening uh, in Nigeria and in Africa, Ghana. There are centers being rolled out where individuals can go to have their bloods tested. And if they are positive, there is treatment available, vaccination or vaccines for hepatitis A, and there's also vaccination for hepatitis B. And when you get the vaccines, then it reduces the risk of you now having a severe liver disease such as cirrhosis, liver failure, or death from liver cancer.
Great. I think you've this, like sort of goes to our brothers, or sisters, actually back home. But let us actually, come over here in a, like in a clean environment like ours that we live in. How do people? Because I think I'll say that from time to time you do get letters from your GP asking to be screened for hepatitis C or A, and I think sometimes you think, oh, I mean, why are they just giving this letter to me? Why is it because maybe I'm black, or is it because maybe I'm from this community? That's why they are sending me this. But I think tonight you've really educated us on this, that it's a necessary thing that like all of us need to actually take on board. And anyone watching us, this can happen to any of you, either the hepatitis A, the B, or the C. So please let us take this seriously. For doc, so can anyone just walk to like to their surgeries and just request for them to be screened? I mean, can we just do that over here?
Um, I think it's possible, but you probably will get a few questions as to why do you want it. For example, all healthcare workers must have hepatitis B screening because if you have it and you don't know, like I said, you may not have any symptoms. The last thing we want to do is for a healthcare worker to be working in a hospital, not knowing that they've got hepatitis B, operating in theater, and thereby transmitting it to patients. But if you go to your GP and you say you want it, they will ask questions from you. If you say, well, I've been living in Africa or Asia, water sanitation has been poor, I don't feel well, could it be hepatitis? They will do the blood test. It's not an expensive test to do. And it's better to know whether you're negative or whether you're positive. The analogy I gave you, you mentioned this environment, and I know your audience could be global, and I think you narrowed it down maybe to the UK. Uh, and again, there are some African countries where you have testing of your car, MOT. So when you get that letter asking you to come for screening, it's no different, or when I say it's no different, it's similar to when you get that letter telling you that your car is due for an MOT, a road worthiness test. So please do not ignore letters when you get such letters. Effectively, they're not telling you you've got disease. All they're saying is, let's check your health. If it's good, then we don't need to do anything. If there are issues, then there is treatment available. And if you avail yourself of the treatment, then that damage to the to the liver will not progress. And that's the key message. It's a simple blood test. So please, if you get called for it, or if you have the opportunity to have the test done, please have it done. And even when it comes out as positive, it's not a death sentence. It shouldn't scare you. And the reason why it shouldn't scare you is that, like we said, some could be self limiting. And like we said, there's vaccination programs going on for hepatitis A and for hepatitis B. A mother who has got hepatitis, when the baby is born, the baby has a regimen of vaccinations that they give to them so that the baby does not develop hepatitis B. So there are modalities available to reduce the risk of individuals getting hepatitis, uh, which we know can be lethal.
Great. So, what are the signs of a healthy liver? Just to assure, you know, those of the people watching us, just to make sure that it's not all that gloomy, but at
Yeah,
least
the sign of wellness
mhm,
generally, you haven't got any symptoms, no headaches, no joint pains, no tiredness. You're living a good life. You're doing everything in moderation. Then, on the balance of probability, you're healthy. You're not overweight. You undertake exercises. So, on the balance of probability, there's nothing the matter. But, like I said, any deviation from normality,
mm,
you cannot tell exactly what it is, and not until you are investigated can somebody say it's A or it's B or it's C or whatever the condition is. So the liver is important because the food we eat, the medications we take, it is through the liver that they go. They go through the liver. That's where detoxification, any toxins are taken away. That's where glycogen, the energy you need to do your day-to-day activities, is stored. So it is important that you keep your liver healthy. And I think alcohol is an issue. Drug misuse in society is an issue.
what about
Uh,
smoking?
Smoking per se, no, is more of lung cancer
Okay.
rather than liver cancer. Yeah. And there was years ago, you will notice that if you have a jar of coffee that you've kept on the shelf for ages, they grow mold, some toxins,
Yeah.
or even some peanuts that have been lying in a jar for ages, you'll find out they grow some mold. It's been reported that those molds also can damage the kidney. So when you have coffee, look at the expiry date, or if you see those white, they look whitish
Hmm.
on the surface. Don't just think, oh, and the hot water will destroy it. No, I'd rather you throw away that bottle, get a new bottle of coffee, and make sure that the ground nuts you take are not one that's been lying on the shelf for ages, because the toxins that grow on those things can also damage the liver cells.
Great education tonight. You've made this discussion very, very simple. And but I just want you to still simplify to our mothers, who have no any like sort of any educational background, but they can speak a little bit of pidgin English. So just like we just want you to sort of summarize everything in a very like in a simplistic way that they can actually take this information also on board, so that they are not left out, because many a times they say, this big grammar, like grammar we don't understand, and sometimes we would love to actually watch and enjoy some of the discussions that we have, but sometimes we can't understand. Yeah, so if we can just break it down in a simple
Yes,
way, please. Yeah.
I have tried to use layperson terms. I'm always very mindful when we do this. You said pidgin English. The thing where they talk, they say the liver where we get now big organ and a very important organ where we say now there everything we they eat, every medication we they take, it go pass through that area. So the bad impurities, the bad things where they inside the food, the bad things where they inside the medication. Now the liver will go, it be like sieve. Now it go come out for our body and we come out through urine or through a poo poo. Uh, but the thing where they talk as well, we say when we they drink too much, it dey damage our liver cells, and when e damage am, then the liver no go fit do the thing wey e for suppose to do. Then we also talk say people wey dey man wey dey sleep with man, dey fit get hepatitis B. Hepatitis B e no good at all, because we know say if dem not treat am, it go damage the cell, the liver itself. And when the thing don't damage, you not go fit work properly. And when you not fit work properly, now then you go to hear people talk say, oh, in get liver failure, in get cancer, and then after cancer, waiting they come. Now death they come if people not treat them well. We also talk say uh, people where they use drugs where we should not dey use like cocaine, make we dey inject ourselves with drugs, recreational drug. Say we want high, we want get that high. No, e no dey good, especially when you dey share the same needle with another person. You no know whether that person get hepatitis or he get infection. You never know whether the person even get HIV infection. So if you dey use the same needle, you fit catch the infection, and if you catch the infection, gradually it go damage the liver. Na im we dey talk today. And I hope say the thing we are talking pidgin English don simplify am a little bit. I know say if you no understand well, and Nana dey there, you tell am, give am the question. E go reach me, we go come back to you, we go tell you, we go answer whatever question. Never dey shy to ask question. Even when you go see your doctor, never dey shy to talk to them, to let them know wetin dey go on with you. And the other thing I will talk about our own community. When our body no dey well, when we don't feel too well, we dey hide am too much. We no dey share, we no dey, you no want family member to know. Maybe na dem dey do you, the home trouble as we dey talk am. No, the earlier we talk to people, or the earlier we go to see the doctor, and the earlier then start treatment, even if you get the disease, then the outcome dey better. But if you keep am to yourself, you not tell anybody, uh, me, oh, I be person where they pray, and I believe also prayer in their work. But they say prayer without action, they go anywhere. Oh. So now the two, because we dey community where some people will say, oh, now only faith, and faith can be, it can be church, or it can be mosque, or it can be any other religion. So, but God give us knowledge. He give doctor and nurses and midwife knowledge. So make we combine those. So my appeal to you, which is part of the education, they say if your body not well, if you feel say it be like say my body, yeah, I feel tired, I dey lose weight, make you go see your doctor. They will do blood test for you, and blood test not dey kill person. And the fact, the result itself, not the kill person. The thing with the kill person is, if the result come back and they say you get something, then and you not do anything about it, then you go get worse. Then make we dey wash our hands properly. Then the food where we dey buy for market, make we dey make sure we wash them well well. The the vegetables, whatever food, and then make we cook them well well. And I'm sure if we do all these simple measures, some of these things it will come out for our body, it will come out for our society.
Thank you so much. Oh, Doc, thank you
You
so
put
much.
me you put me on the spot there. I can't remember the last time I spoke. The last time I spoke pidgin English.
I know, but you've done well. You've done well. I think, and I'm going to get a lot of feedback. I mean, for what you've done, but thank you, thank you. I've got one last question for you. Jemima is still, also with us, and she's asking, what are some of the foods that can help to clear your liver?
Yeah, I think it says that can clean the
Sorry,
liver.
clean. Sorry.
Yeah, I mean, food per se doesn't clean the liver. It's excessive food. If you eat too much food, the liver, like we said, is the engine room that deals with it. So if you eat too much carbohydrate, where it comes to as fat inside the liver, you know they're good. So the thing about food generally is let us eat a balanced diet. Let us eat in moderation, not big bowl of rice, fufu, in moderation. So food per se will not clean the liver. The liver is supposed to act as like a gate man, an engine room where they deal with all of these things. But it comes a time when engine room they knock. If
Yeah.
you don't abuse them. And now you asked me before about fatty liver. If fat too much, fat don't replace all the good liver cells, then it go damage them. So eat in moderation. My advice to you, eat in moderation. If you eat a balanced diet, you're unlikely to be overweight. If you exercise, exercise is very important. The 10,000 steps that we advise to have every day helps a lot of things, cancer, liver health generally. Uh, so let us stick to healthy living, sleeping well, your 6 to 8 hours sleep a day, and avoiding excessive alcohol, excessive smoking, and let us avoid high risk situations where we're injecting drugs. Some of these, I don't know what they call them, all these new generation drugs that make people high when they go to parties. Again, they are not good for the liver. Some of them are also not even good for the kidneys. I know today is not about kidney health, but even some of the weight reduction medication on the market can damage the liver, can damage the kidneys. So we've got to be very careful. If you put bad thing inside your mouth, then it's going to damage something in your body. So watch what you put inside your mouth. Watch what you eat. Eat well, eat in moderation. And if you do that, I can reassure you that you will have a healthy lifestyle.
Thank you so much, Professor Rotimi. Thank you so much. You said something that we should insult our bodies, and now you're saying that we should watch what we put in our mouth, in our bodies, and like it looks like our mouth is the gateway into our body, so we should be mindful of what we put into our mouth. And I guess tonight we've been educated. You know, I've learned so much, from your discussion, and I hope anyone watching us has equally been educated as well. Such discussions are so important. I would just urge anyone that happens to watch this later, kindly share, to your friend, to your family member, and then to the community. Let us, make sure we look after our organs properly. We look after ourselves well, and together we can all have a long life. And also, it will also reduce the weight on our doctors and, like in the long run, on our families as well. So take good care of yourself, watch what you eat, exercise more, and if you get any letters through the post from your GPs for screening, please do so. Um, just go for the blood test. Just like Professor Rotimi told us now, it's not a death sentence. The earlier the better. You get treatment, and so liver health is so important. And tonight, I couldn't say thank you enough to Professor Rotimi for your time, knowing how busy you are. But anytime we knock on your door, you gladly open us and educate, us. So thank you once again, and we
It's
wish
a
you well.
pleasure.
Yeah. And so your final words, to your family and also to anyone, watching you, and also us. Yeah. Thank you.
Lovely, thank you. My final parting words is I think you summarized it nicely. What we put into our body uh, orally, that is, what we eat, is important. What we do to our body is also very important. If you are injecting material directly into your bloodstream, it's going to go via the liver. So do not misuse drugs. Uh, do not take food that is contaminated, and do not overdose on tablets. If you've got back pain, don't go taking 10 tablets of paracetamol in a day. And one of the things that I would want to mention here is our mental wellness.
Hmm.
Loneliness, depression. I have tried to avoid the word suicide. The reason they limit us to only 32 tablets of paracetamol is because it's one of the easiest way of committing suicide. If you take more than 8 tablets, it will damage the liver, and that's why pharmacists will not let you buy more than 32. And so mental wellness, which is not today's topic, but is a very pertinent topic. If you are not feeling very well mentally, some people eat a lot. That's where they get their comfort, and then they become overweight, obese. Then you get a fatty liver. So I'm sure it's for another day. I'm sure Nana, our hostess, will be. I'm sure you dealt with the topic in the past, but we cannot overemphasize the need to keep our health physically, emotionally, mentally in good shape. Thank you.
Thank you so much, Professor Rotimi. Thank you. Professor Rotimi is a very, very busy man. And anytime I have him, it feels like a pot of gold because it would take something, for, he's so busy, very, very busy. And I do not take this time that you've spent with us for granted at all. And so thank you. And we just wish you well as well.
Thank you.
Yeah, thank you. Thank you.
Lovely. Thank you for having me, and thank you to the audience for
Yeah.
tuning in. Share this with your family members and your friends as well.
Oh,
Thank
thank you
you.
so much. Thank you. So, and to anyone that has stayed with us till now, I say thank you so much for your company, and hope to see you, another time. Thank you. Bye bye, and have a blessed week. Bye.